Hi, my name is Dina, and today I will be administering the intramuscular injection. I have all my supplies here in front of me. I will start off by verifying the healthcare provider's orders. Then I will verify the six rights of medication administration, which are the right patient, right drug, dose, time, route, and documentation. I will then verify the doctor's orders in the MAR EHR. And for this patient, he ordered 6 milligrams of morphine, and it is supplied in 4 milligrams per 1 ml. So we will need to withdraw 1.5 mLs to get our 6 milligrams per 1.5 ml. I'm going to start off by introducing myself to the patient, and I will go ahead and provide patient privacy, and I will ask the patient for two identifiers, and I will cross-reference with their wristband to make sure that I have the correct patient. Then I will ask my patient if they have any known allergies to food, medication, or seasonal. Then I will go ahead and inform my patient the medication that the doctor is administering and provide him some education on it. Okay, sir, your doctor ordered a morphine injection for you. Morphine is used to treat moderate to severe pain, and it works by blocking signals in the brain and the nervous system. Some of the common side effects for this medication include nausea, vomiting, and constipation. And the more concerning side effects include dizziness, lightheadedness, difficulty breathing, or hives. Please let me know if you experience any of those at any moment. Also, just so you know, you may feel slight burning or a stinging sensation while I'm administering the injection. Um, do you have any questions for me? Okay, we're going to go ahead and move on. We're going to go ahead and perform hand hygiene, and I will apply clean gloves. Okay. Now I have my 22 gauge 3 milliliter syringe with a 1 inch needle. I am going to go ahead and start off by wiping the top of my vial of medication with a clean alcohol pad. Then I will go ahead and add 1.5 mLs of air into my syringe. Then I will go ahead and release this air into my medication vial. Then I will withdraw my 1.5 mLs of medication. Okay, at the same time, I'll be checking for any air bubbles. Okay, 1.5 mLs. Then I will recap my needle, and I will verify that I do not have any air bubbles. And then I will go ahead and demonstrate my 1.5 mLs of medication in my syringe, and I will put that to the side. Now I'm going to start off by locating my patient's injection site. So it will be the ventrogluteal site, and I would have the patient lying down in a supine or lateral position. Then I will go ahead and put the heel of my hand on the greater trochanter, and I will make sure that my wrist is almost perpendicular to the femur, and I will point my thumb towards a patient's groin, and I will extend my fingers up along the patient's iliac crest. The site will be the V in between my index finger and my middle finger. That will be the iliac crest, and that will be where we will be injecting for this patient. Okay. So before I do any administering the medication, I will need to make sure that I assess my patient's skin. So I will be noting for the skin integrity and the size of the muscle. I will also assess for any bruising, skin irritation, or edema on the skin, and make sure that he hasn't had a recent injection on that site. I will also palpate for tenderness or hardness. And if I notice any irregularities, I will avoid these areas and rotate the site if my patient receives frequent injections. Okay, so now first we're going to go ahead and start by cleaning my patient's site with an with an alcohol pad. So right over here is our site. I will go ahead and clean it in a circular motion, going 2 inches out. Then I will go ahead and make sure that that this dries completely, and we do not want to blow on it or hand dry with by waving our hand over it. And we also do not want to touch the site once we have cleaned it. Okay, so now I'm going to go ahead and get started by holding my syringe between my thumb and index finger, and I'm going to be injecting in a 90-degree angle. Once I have identified my site, so I will go ahead and place my hand here. Then I will go ahead and grasp the muscle to increase the muscle mass. And with my dominant hand, I am going to go ahead and quickly inject straight into a 90-degree angle. Then with my non-dominant hand, I will hold the syringe, the barrel of the syringe, and try not to move the syringe inside of my patient. And with my dominant hand, I will push on my plunger, and I will make sure that I have stabilized the syringe, and I will inject the medication at a rate of 10 seconds per ml. And then once we have administered the medication, we're going to go ahead and wait for 10 seconds and before withdrawing the needle. Then I will release my patient's skin and place a gauze over the site. Apply gentle pressure, making sure that we do not massage the site, and then we will apply bandage if it's necessary. Then I will make sure that I toss my needle and syringe inside of a sharps container, and I will remove my gloves, perform hand hygiene, and I will document the procedure.